He was alone in his kitchen when his arm went numb. His words began to slur. And instead of freezing, he did one thing that bought him time before the ambulance arrived. Welcome to Senior Health and Wellness Hub. After years of researching emergency medicine and what actually saves lives after 60, today's story still stops me cold. Because this man didn't use luck. He used knowledge. And that knowledge? It came from understanding something most people never learn. What to do in the minutes during a stroke, not just before or after. Let me tell you something surprising. According to data from the National Institutes of Health and the American Stroke Association, many strokes don't happen in seconds. They evolve over minutes. That window is small, but it exists. And what you do inside that window can change everything. The body whispers before it collapses, weakness, facial heaviness, confusion that feels subtle at first. Most people wait, and that waiting, that's where the real damage accelerates. So in today's episode, we're diving deep into what happens during a stroke, what the body is doing, what the brain is losing, and what one simple action can do to slow that loss. I'll explain why this works physiologically, how it affects blood flow, oxygen delivery, and why seniors respond so strongly to it. But I'm not giving away the full method just yet, because understanding why it works matters just as much as knowing what to do. This isn't about replacing emergency care. It's about protecting your brain while help is coming. When you understand the reason, you remember it under stress. And memory saves lives. So stay with me, because what stopped this stroke mid-attack wasn't strength. It wasn't medication. It was timing, positioning, and a body responding exactly as it was designed to. Let's start with the question that matters most. What is actually happening inside the brain in the first moments of a stroke? And why are those moments not as hopeless as you've been told? Here's what most people never see. When a stroke begins, the brain isn't dead, it's panicking. Blood flow slows or becomes blocked. Oxygen drops. Nerve cells stop communicating clearly, but many of them are still alive. They're waiting. That's the key distinction. Waiting, not failing. Seniors are often told that once a stroke starts, everything is already lost. That belief? It's dangerous. In reality, the brain enters survival mode. It reroutes signals. It lowers activity. It tries to protect itself from total collapse. This is why early symptoms feel strange but not always dramatic. Heaviness, tingling, trouble forming words, confusion that comes and goes. Those aren't random symptoms, they're warning flares. According to research published by the National Institutes of Health, neurons can survive several minutes with reduced blood flow if oxygen demand is lowered quickly, which means the clock hasn't run out yet. But make no mistake, the clock is running. Every second matters. And what the body does during those seconds determines how much tissue survives. This is where the idea of a mid-attack intervention becomes real. Not stopping the stroke entirely, but slowing the damage. The brain has what doctors call a au-mine penumbra, a surrounding zone of threatened but salvageable tissue. That zone can be protected temporarily if circulation dynamics change. Emergency medicine focuses on restoring blood flow later, in the hospital. But this is about protecting the brain before help arrives. And here's what makes this critical for seniors. Aging brains are more sensitive to oxygen loss, but they also respond strongly to changes in posture, pressure, and breathing, which most people never consider during an emergency. Why? Because panic takes over. The body stiffens, blood pressure spikes, oxygen demand increases. All of that accelerates damage. So the worst thing isn't just the clot, it's the stress response layered on top of it. Stress narrows vessels further. It increases heart rate. It worsens ischemia. Calming the system isn't about comfort, it's about physiology. And this is where the man in our opening story made a different choice. He didn't fight his body, he worked with it. He unknowingly supported cerebral perfusion at the exact moment it mattered most. But before I explain how, we need to understand something else. Why seniors often miss these early signs, and why waiting feels reasonable in the moment. One of the most dangerous parts of a stroke isn't the clot, it's the hesitation. Why do so many seniors feel something is wrong but still choose to wait? Because strokes rarely announce themselves loudly at first. They whisper. The brain becomes confused, not alarmed. People feel not off, not endangered. That false calm is what delays action. I've researched case after case where patients sit down, tell themselves it will pass, don't want to overreact. And the brain? The brain helps them rationalize. When oxygen drops, judgment weakens. Decision-making slows. The very organ that needs help becomes less able to ask for it. So the stroke interferes with the ability to recognize the stroke. This is well documented. Studies in the journal Stroke show that early ischemia reduces executive function first. That means planning, urgency, and judgment decline before strength or consciousness, which explains why people say things like, I didn't think it was serious yet. The brain protects itself emotionally by minimizing danger, especially in seniors who have lived through discomfort before. They're used to pushing through symptoms. There's also fear of hospitals, fear of being wrong, fear of causing trouble, and fear increases hesitation. Hesitation increases damage. This is why education matters before the emergency, not during it. Because once confusion sets in, logic is already compromised. That's why rehearsed knowledge saves lives. When the mind cannot reason, it falls back on memory and habit. This brings us back to the man in the kitchen. He didn't decide what to do in that moment. He remembered. His body responded faster than his fear. That response reduced stress, slowed oxygen demand, and supported blood flow to vulnerable brain tissue. And that response didn't require strength, medication, or equipment. It required positioning, breathing, and understanding how the body behaves under pressure, which is exactly what I'm about to break down. The principle behind the action. Not the step itself yet, but why it works at a biological level. Because when you understand the reason, you don't panic, you act. And acting early is what separates recovery from regret. This is for informational purposes only. For medical advice or diagnosis, consult your doctor. Now we reach the turning point, the part people don't expect. What actually buys the brain time during a stroke before treatment begins? It comes down to oxygen balance and pressure, not medication, not force. The brain survives when oxygen demand drops faster than oxygen supply. That sounds simple, but most people do the opposite in an emergency. Panic increases heart rate. Breathing becomes shallow. Blood pressure spikes. All of that raises the brain's demand at the exact moment supply is compromised. So the brain is being asked to work harder with less fuel. That mismatch? That's what kills tissue. Not instantly, but progressively. The human body has built-in mechanisms to protect the brain during low oxygen states. The body knows how to prioritize the brain, but stress shuts those mechanisms down. Calm activates them. Most people think action means movement or effort. In this case, doing less is more. Reducing strain, lowering resistance, allowing blood to move where it's needed most. This isn't about replacing the hospital. It's about protecting the penumbra, the zone of threatened but salvageable tissue. Studies show that every minute of untreated stroke can destroy nearly 2 million neurons. Slowing that process changes everything. This is where theory meets the body. Blood responds to gravity, pressure, and resistance. In an emergency, most people instinctively choose the wrong response. They pace, they sit upright and tense, or they panic. Each of those can worsen cerebral stress. When fear takes over, muscles tighten and pressure inside the skull can rise. The goal is optimal perfusion, getting blood to the brain with the least resistance. For seniors whose blood vessels are less elastic, even small changes in posture or angle have a massive impact. Without knowing it, many people steal oxygen from their own brain just by how they react. Before we discuss the action, we must draw a clear line. This is a bridge, not a cure. The moment symptoms appear, weakness, slurred speech, or facial droop, emergency services must be contacted immediately. This method is used while help is on the way. However, if the person loses consciousness, has severe trauma, or if their breathing becomes unstable, you must follow standard emergency protocols. This is about stabilization, not stimulation. Calm is protective. It lowers oxygen demand and supports survival. What exactly did the man in our story do? He lowered his body. He didn't stand or pace. He changed position deliberately. He lay down on his side, the recovery position, to keep his airway clear and safe. He kept his head slightly supported, not flat, but not too high, just enough to manage intracranial pressure. This position reduces strain on the heart while supporting blood flow. And then there was the breathing. If fully conscious, he focused on slow, controlled nasal breathing, longer exhales than inhales. This signals the nervous system to stand down. It lowers the heart rate and decreases the brain's oxygen demand. The brain asks for less, while the body provides what it can. Movement increases demand. Stillness preserves tissue. To summarize, side-lying position, head slightly supported, and slow nasal breathing while help is on the way. Knowing this only helps if it stays with you under stress. The brain doesn't rise to the occasion, it falls back on what it remembers. Rehearse this when you are calm. Picture the signs, then imagine the response. Side-lying, head supported, slow breathing. Mental rehearsal makes it a habit. This restores agency. Instead of waiting helplessly, you have a role to protect. That shift reduces stress hormones, which further helps the brain. Most people think survival comes down to luck, but what saved this man was memory. He didn't fight the stroke. He gave his brain space, time, and oxygen. How many outcomes change because of what happens in the minutes before the ambulance arrives? Emergencies don't ask if you're ready. They only reveal whether you are. Side support. Slow breath. Simple. Human. Powerful. The body knows how to survive. It just waits for permission. The next time your body whispers, will you know how to respond? If you found this information valuable, please share it with someone who needs to hear it. Subscribe to Senior Health and Wellness Hub for more life-saving health information, and leave a comment below if you have questions. Remember, preparation, not panic, saves lives. I'll see you in the next episode.